Good afternoon. Joining me today are our Health Secretary, Dennis Schrader, Brigadier General JANEEN BIRCKHEAD of our Vaccine Equity Task Force, Executive Director of the Maryland Primary Care Program, Dr. Howard HAFT, and Adam KANE, who is the Chairman of the Maryland Health Services Cost Review Commission. This is an exciting day for Maryland. We are now one big step closer to reaching that light at the end of the tunnel that we've all been talking about. Today, exactly 1 year after confirming the first Maryland death from COVID-19, our state has officially surpassed the milestone of 2 million vaccines administered. It took 67 days to reach the first million doses, but just 27 days to double that and reach 2 million doses administered. Maryland is vaccinating residents at a faster rate than 34 other states. We've vaccinated more people than 34 other states and administered more vaccines at long-term care facilities than 37 other states. We're now averaging a record 43,034 shots per day, which is an increase of more than 1,300%. Thanks to Secretary Schrader and his team at the Maryland Department of Health, as of today, nearly 25% of all Marylanders have gotten a vaccine, including nearly 2/3 of all Marylanders over 65. We now have an infrastructure capable of doing 100,000 shots or more per day. As of today, the Six Flags America vaccination site has done more than 100,000 vaccines. Tomorrow, I will be making numerous stops all across the Eastern Shore, including the new mass vaccination site at the Wicomico Youth and Civic Center in Salisbury. We will open our 6th mass vaccination site 1 week from today in Western Maryland. In addition, we're in ongoing discussions with a number of other jurisdictions regarding additional mass vac sites, and we'll likely be making further announcements regarding that in the coming days. We now have 2,424 different distribution points all across the state of Maryland. Maryland created the most advanced equity plan in the country, which continues to focus like a laser on our efforts to reach underserved communities. In early January, we launched the Maryland Vaccine Equity Task Force, which is working with trusted community leaders and local health departments to focus COVID-19 vaccination efforts in vulnerable, hard-to-reach populations. 50 task force missions have already been completed or are currently in progress all around the state, with more to come. As I've repeatedly stressed, the biggest challenge that we're faced with continues to be supply. That's what all states are currently receiving, a limited supply from the federal government. Fortunately, there's finally some really good progress on that front. Last week, you all heard President Biden announce that every adult in the United States would be eligible for the COVID-19 vaccine no later than May 1st. Earlier this week, we had a meeting with the White House Coronavirus Task Force where America's governors were informed that not this week or next week, but beginning the week of March 29, all states would begin to see a significant increase in vaccine supply. And based on Maryland's rapidly accelerating vaccination rate, the infrastructure that we have built, and this anticipated increase in vaccine supply from the federal government, today, I am pleased to announce that the state of Maryland will now enter phase 2 of our COVID-19 vaccine plan. Beginning next Tuesday, March 23rd, under phase 2A, all Marylanders aged 60 and older will be eligible to receive a COVID-19 vaccine. And immediately, effective today, any Marylander over the age of 60 can pre-register for a COVID-19 vaccine appointment at any of the state's mass vaccination sites by visiting covidvax.maryland.gov or by calling the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX. Once pre-registered on our new registration system, eligible Marylanders will then be notified once an appointment is available, and will be able to verify their pre-registration status and reserve appointments for vaccines. Nearly 90% of the state's 7,929 COVID deaths have been Marylanders over the age of 60. By prioritizing this age group, we will take a huge leap forward in the effort to protect our most vulnerable citizens from this virus. 1 week later, on Tuesday, March 30th, we will move into Phase 2B of our plan, which will include all Marylanders 16 years and older with underlying medical conditions that increase the risk for severe COVID-19 illness, and they can start to be vaccinated. According to the CDC, nearly 90% of all the individuals hospitalized for COVID-19 have had an underlying medical condition. The third and final wave of Marylanders in Phase 2 will become eligible for COVID vaccines beginning April 13th. This Phase 2 includes all Marylanders 55 and older, as well as all essential workers of any age in critical industries, including food services, utilities, construction workers, financial services, IT, and many other infrastructure categories. Finally, no later than Tuesday, April 27, Maryland will enter the final Phase 3 group, which will include every single Marylander over the age of 16. I want to stress that even though we're now moving into Phase 2 of our vaccine plan, all individuals who are currently eligible under Phase 1 but have not yet been vaccinated will continue to be prioritized for appointments at all of our mass vaccination sites. I also want to continue to remind Marylanders that just because you become eligible for a vaccine does not mean that you can immediately get a vaccine, and that we can't schedule appointments for vaccines that we don't have or that don't yet exist. Supply will be ramping up to meet all of the demand, but to be clear, we do expect that demand will continue to outpace the supply for at least the next several weeks. With the announcement of this plan, now every single Marylander knows when they become eligible to receive a COVID-19 vaccine. Our goal throughout this process remains the same. We do not want to leave any Marylander behind. And to achieve that goal, equally as important as moving forward with our phased, data-based, well-thought-out vaccination plan is to also continue expanding the channels available to Marylanders to get vaccinated. In addition to the current 6 mass vaccination sites, we have clinics at 227 nursing homes and 1,700 assisted living facilities. As of today, we're now increasing to 275 pharmacies, 38 hospitals, and our 24 county health departments. Our plan calls for the number of distribution points to continue to grow nearly every day. In addition, today we are launching an innovative pilot program to provide vaccine doses directly to primary care practices throughout the state. All these steps allow us to continue to provide a faster, more equitable vaccination response in Maryland. Maryland's primary care practices have been essential in our COVID-19 response here in Maryland, from pivoting to telehealth services to standing up COVID testing clinics. These providers they already have trusted, long-standing relationships with their patients, which are critical to helping us boost vaccine efforts. And with this innovative program, primary care providers will be able to call their patients directly to schedule vaccine appointments, which will minimize technological and access barriers and reach individuals where they are. This initial pilot that we're launching today will include 37 practices throughout the state, including ones that serve largely African American and Hispanic patients, and those that serve communities with less geographic access to other vaccination sites. This program is made possible through an existing partnership of primary care and public health within the Maryland Primary Care Program, which is a statewide advanced program that connects the Maryland Department of Health with 562 primary care practices across the state. In addition, we are launching a new $12 million COVID-19 community vaccination program led by the Maryland Health Services Cost Review Commission. This program will fund hospital-led community-based vaccination initiatives by utilizing Maryland's one-of-a-kind Maryland model healthcare finance system, which was initially conceived, designed, and accomplished by Secretary Dennis Schrader, and which has been called the most innovative in America. As leading healthcare providers in our communities, hospitals are uniquely positioned to support local community-based vaccination efforts. Many have already partnered with us to undertake vaccination efforts all across the state, and including through partnerships with local health departments and community-based organizations. But through this new grant program, hospitals will now be able to expand to work with even more trusted community partners, including local health departments, nonprofits, faith-based organizations, and others, to increase Marylanders' access to the COVID-19 vaccine with a focus on vulnerable, underserved, and hard-to-reach areas. From day one, our state has played an outsized role in the fight against COVID-19. More than 40 Maryland companies and institutions have been involved in developing tests, COVID-19 vaccines, and therapeutics. And Maryland has led the nation throughout this COVID crisis, and we're continuing to lead with our vaccination efforts. And now we are the only state in the nation that has the infrastructure already in place to launch a partnership of this kind with our state's hospitals. Finally, today, through the Maryland Vaccine Equity Task Force, led by General BIRCKHEAD, we are announcing the launch of mobile vaccine clinics in hard-to-reach rural areas of the state, and by utilizing mobile units provided by the Maryland School of Nursing. These units will be deployed and staffed by the Maryland National Guard, and I'm looking forward to seeing them in action tomorrow with the General on the Eastern Shore. As we continue to leverage every possible resource we can to get shots into arms as efficiently and equitably as possible. We have built the infrastructure capacity, and we're being promised the increased supply to be able to vaccinate every Marylander in the next couple months. I can assure you that Secretary Schrader and our entire team will not rest until every single Marylander who wants a vaccine has received a vaccine. And I want to ask all Marylanders to please get vaccinated when it's your turn. These COVID-19 vaccines have been proven to be safe and effective. They're administered under medical supervision, and getting vaccinated is absolutely vital to stopping the spread of COVID-19 so that we can return to normal life once again. I want to sincerely thank all of the vaccinators, the Maryland State Health Department, the Maryland National Guard, our hospitals, pharmacies, and local health departments, and the literally thousands of dedicated people who have been literally working around the clock 7 days a week to help us reach this moment. We owe them a tremendous debt of gratitude. At this time, I'm going to turn it over to Adam KANE, the chairman of the Maryland Health Services Cost Review Commission. He's going to provide a little more detail on our new first-of-its-kind Maryland model hospital provider vaccine equity program.
Thank you, Governor. Maryland's hospitals and health systems are here to answer your call and continue to answer your call to leave no Marylander behind in this great endeavor. On behalf of the 7 commissioners on the Health Services Cost Review Commission and the 50 dedicated staff, I'm pleased to announce that we will be meeting next week to create this community vaccination program. Maryland's unique rate-setting agency governs all 47 acute care hospitals. Maryland's hospitals have been providing care to COVID and, frankly, lots of non-COVID medical need throughout the past year and are truly heroes. And I would like to join the governor in thanking Maryland's hospitals, healthcare workers, nursing home workers, and all senior living communities who played an outside role with this very strong state and the strong state response. The HSCRC will be making applications available for all Maryland hospitals March 25th for a rolling funding program. $12 million, as the governor said, will be immediately available to expand vaccination programs to vulnerable populations. Hospitals will be working closely with local health departments, using technology through CRISP and other means to identify vulnerable zip codes and provide access to vaccines by any means necessary. We know that relationships between hospitals, doctors, nurses are really what's going to get vaccinations out to the most vulnerable populations, and we know this important program will contribute to that effort. As the governor mentioned, this program, as well as the Maryland Primary Care Program, is very much related to Maryland's unique all-payer total cost of care contract that we have with the federal government. The total cost of care contract focuses our health systems and efforts on improving health outcomes, improving population health, and managing chronic diseases. The contract was so ably negotiated by the governor and Secretary Schrader back in 2019, even before any of the COVID pandemic was on anybody's mind. So we are very pleased to be able to use the tools under this waiver to accomplish this very important goal. Thank you very much.
Thank you. I'm Dr. Howard HAFT. I'm the Executive Director of the Maryland Primary Care Program, which is a division under the Maryland Department of Health and Public Health. And I'd like to start by thanking Governor Hogan, General BIRCKHEAD, Adam, and the Secretary Schrader for their leadership throughout this crisis. It's really been remarkable how so many people have come together to address this horrible pandemic in so many ways, particularly now with vaccines and the ongoing search for equity. I have to say that the governor was eloquent in almost completely reading my talking points, so I have little to add except to say that, echoing what Mr. KANE said, that it's again because of the forethought of having a Maryland model where hospitals are organized and providers are organized together, that they're able to respond in these kinds of crises in a unified way under the direction of leadership, and be able to do what they specifically are able to do. In the case of primary care providers, as I said, we have 562 sites across the state that are organized under the Department of Health and Secretary Schrader, who stand at the ready and have stood at the ready to respond in every way to this crisis, and now are beginning to respond in terms of being vaccinators. And as the governor said, they have a special way of adding their resources to this fight. This is clearly an and situation. It's using the great resources that we have at the mass vac sites. It's the resources that we have at hospitals, at pharmacies, at local health departments, and now also those resources from our community providers who have a special relationship with their patients and who can address issues of vaccine hesitancy when necessary in a personal way. They're in the communities much the same as pharmacies are. They have the ability to directly reach out to their patients in an equitable way and identify those who are in most need. And as we enter into phase 2 of this process, they will also be able to be at the ready to identify those who have underlying medical conditions. So I think it's remarkable, and I thank everyone here for their efforts, and we look forward to the efforts that our primary care providers will make, what their practices will make, their staff will make, in adding to into winning this battle in the war against COVID-19. Thank you.
Thank you, Governor Hogan. Good afternoon, everyone. It's always an honor to get a chance to talk about what a wonderful partnership we've had working with the Vaccine Equity Task Force and the community. And we are pleased to work with the Maryland Primary Care Program and the Maryland Health Services Cost Review Commission. The Maryland Primary Care Program practices are working with the Vaccine Equity Task Force already, trusted leaders and partners and locations, and these are two of the tenets that we've already seen work well. The primary care providers establish trusted relationships, which allows Marylanders to receive information from knowledgeable sources, but also the ability to dialogue directly with their providers, and we realize how important that is. Providers will connect with the patients, schedule appointments to minimize technology and access barriers. Moreover, they are usually located in an accessible area or an area where that patient is familiar with going. This will minimize and mitigate barriers for travels for individuals. As we've demonstrated with our faith-based organizations, trusted voices are important, and so are hospitals. The trusted healthcare Maryland institutions such as Holy Cross and Johns Hopkins and have worked with the Vaccine Task Force since we stood up, and we will continue to work in tandem with them in various locations across Maryland. We are looking forward to working with the Maryland Health Services Cost Review Commission on their COVID-19 Community Vaccination Funding Program to create opportunities to strengthen community partnerships and support long-term sustainable initiatives that will address healthcare disparities. The COVID-19 Community Vaccination Funding Program will help to optimize and expand the hospital's existing community-based programs. This program aligns really well with the Vaccine Equity Task Force's current mission to increase statewide vaccination rate and particularly to get into underserved areas in Maryland. This will accelerate our efforts and grow our initiatives. On Friday, we will launch the wellness buses, or the mobile vacs, to assist in the acceleration of getting vaccine into hard-to-reach areas on the Maryland's Eastern Shore. This is another way to meet people where they are. These vehicles were obtained through a partnership agreement with UMS and the Vaccine Equity Task Force, and I have to give a shout out to the Maryland Army National Guard, where our maintenance shop in Dundalk spent tireless hours fixing these buses to be ready to roll in the communities. Each mobile vaccine bus has the versatility to be used as a walk-up clinic, or we can use it as a drive-through facility. Individuals have the option of receiving the vaccines inside the bus or staying in the comfort of their cars, and the vaccinator will come to them. Aboard each bus, there's a tablet that allows for easy registration and scheduling of appointments, and actually that follow-up appointment. So it is a one-stop shop. The Vaccine Equity Task Force will continue to work closely with the local health department and use our data-driven approach to discern where to best use these buses. Again, I would like to thank our partners and the community for working with us as we advance community immunity. As more vaccine becomes available, we will work quickly as possible to support the administration of these vaccines. Please call 1-88-MD-GO-VAX if you need assistance. Thank you to the pilot primary care providers for their time and resources in this campaign, much appreciated. And thank you to the Maryland Health Services Cost Review Commission for launching this funding program to aid in putting vaccine into arms and increasing equity in Maryland. Thank you very much. Maryland, go Vax.
With that, we'd be happy to take a few questions.
Looking at this whole plan, you're going to announce, you're going to move to these different phases now, advancing the vaccination efforts here in Maryland. A lot of people don't want to have to sign up to get a vaccination. With this announcement today, does this mean at some point you'll be able to walk up to a clinic somewhere and get a shot, or is pre-registration always going to be
That's a great question that maybe I'll let our health secretary address.
Yeah. Part of the reason we've got the pre-registration system in place is to create the opportunity for people to register in one place and then we will manage that list. With the volumes of people we're expecting, we're going to need that for a while longer. Maybe by the time we get to the fall, we're hoping that we'll have vaccine on every street corner in a pharmacy or through primary care, and it won't be as important. But right now, we need that pre-registration to manage the flow of people.
Governor, you talked about the fact that the federal government is saying that we'll be getting more vaccine by the end of the month. What have they told you to expect? What kinds of increases are you looking at for the end of the month and moving into April and May?
They were careful not to commit to exact numbers. I mean, I think I told you guys 2 weeks ago, we had a talk with the task force, and they said, they kind of pushed the meeting this week. They pushed the time frame back 2 weeks. So while they encouraged everybody else to move the time frame up, they actually told us we had to wait another 2 weeks before a substantial increase. We're getting incremental, small increases each week, which we're very appreciative of. But I think we're going to jump to a really significant level. I don't have an exact number, and they haven't given us final numbers, but I think it's going to be significant. I mean, I really believe that if they deliver on what they say they're going to deliver, that April is going to look a heck of a lot different than March, and that while we're very close to 50,000 a day, that we can get to 100,000 a day.
In terms of 37 practices you mentioned primary care physicians, you able to say who they are at this point so that people will be able to know and where they will exactly be located?
Yeah, I'll let Dr. HAFT maybe try to address that one if he wants to. But this is, again, the pilot program. Just to start this program out, our goal would be to have these vaccines eventually at every one of those primary care physicians and elsewhere, so that you can go to your doctor and get a vaccine. When we get the supply, that's the ultimate goal. Doctor, anything you want to add?
Sure. Thank you. As I said, this is the 37 as a pilot. It's a matter of they were selected because, number one, they volunteered. Number two, they were already Immunet capable. Immunet is our state registry for vaccines, so they were able to identify their patients who, based on this registry and through our state designated health information exchange, each one of these practices can tell who's been vaccinated, who hasn't been vaccinated, and also can sort those patients based on their underlying medical conditions, their ages, and also their race and ethnicity. So these practices particularly are ready to do that and really ready to lean in right now on the equity issue. So they can selectively reach out to those who have been left behind more than others, and they have these relationships. So this is just the tip of the iceberg, and it's, again, will very quickly, as the governor said, go from a small pilot to a very large group. Some of the limitation, as has already been said, has to do with simply the fact that there's not enough vaccine right now to give to 400 practices, for instance. We need to wait till that time comes when we do have increased numbers, and then they'll be distributed equitably. But they represent virtually every place in the state and lean in very heavily on health equity.
I'm glad I gave that question to him. That was an excellent answer.
Governor, I know that you have an extensive marketing campaign about anti-vaccine people, but we're starting to hear some stories about people showing up for appointments, finding out what vaccine it is, and leaving, refusing to take that vaccine. Are you worried about vaccine shopping as people?
We haven't heard too many reports of that. I would say that would be a very serious mistake. All of these vaccines are tremendous. They all surpass any equity, any efficacy expectations that anyone ever had, and better than just about any vaccines we've ever had in this country. There's such a short supply and such tremendous demand. Anybody that walked away and said, I don't want that vaccine, I want to wait until there's another one, may be waiting a while. So I think it would be a big mistake.
Governor Hogan, this morning on the Today Show, Dr. Fauci said some states are pulling back and opening up now, and he said he is worried about it, that these states are doing this really a little more prematurely than they should. A lot of people listen to Dr. Fauci. Do you think Maryland is doing this the right way in terms of reopening?
I do. I think I listen to Dr. Fauci. I've talked to him throughout the entire crisis for more than a year as I was leading the nation's governors, and I did hear his comments. And I agree with his comments. I think there are states that are moving too quickly. We're just not one of them. I mean, I think states that, and I've said, the states that were lifting any kind of distancing, lifting masking, are making a mistake. We're trying to find that right balance. I believe we have. Some states are still have all their businesses closed. They're suffering terribly economically. And other states are wide open with crowds of people with no masks, and they're suffering the health consequences. We are better than most states in the country, both on our health metrics and on our economic recovery. And that's exactly the balance where we want to be. But we watch it every day. If there are concerns, we're going to make adjustments as we have throughout this. But I believe it's the judgment of all of our entire team that meets nearly every day with lots of public health experts and people all from inside and outside the government, that we are kind of where we should be. And I think maybe, I don't want to be critical of any of my colleagues, but maybe some of them should be where we are, rather than on either end of the spectrum. We're sort of right down the middle where we think there's a good balance.
And Governor, can you sort out the situation with Montgomery County officials saying that they are opening up a mass site? You did not mention them today. I just wanted to find out where they are in the lineup.
So we are in discussions with a number of counties, local jurisdictions, including Montgomery County, as I mentioned at the beginning of my remarks, that we'll have some announcements shortly in the coming days about additional mass vaccination sites. But, some council members in Montgomery County, I think, jumped the gun and made an announcement that wasn't quite there yet. And we're continuing to talk with them every day.
So Marilyn, when it comes to these moving to the next phases and counties are moving a little slower than others, what do you tell some counties who are still in phase 1B or C, who have just moved to 1C right now? Are you directing them to move forward? This is now the time?
Well, we're going to be talking about that with our health department and with our local leaders. We're just making this announcement today. We want to give them some time to digest, and we'll probably be making further announcements in the next few days. And we're in conversations with all the county leaders almost every day. I'm sure we're going to be having those discussions. But as this supply is increasing, and we're, first of all, the county health departments are the ones moving at a sometimes different pace. Our mass vac sites are following the state plan. Pharmacies are, hospitals are. There's only 24 jurisdictions, and maybe 2 or 3 of them are not in line with the state plan. We've kind of given them some flexibility, but they may get left behind, and as the supply increases, there's going to be no excuse for any county to not be moving into phase 2. I understand the concerns early on when we didn't have enough supply, but the supply is going to be pouring in, and it's going to go where we can stick needles in people's arms. And if people are going too slow, they're going to be missing out.
Governor, are you confident in the supply that's coming, based on what we've heard from the White House and everyone else, and the way this has all been come out?
I'm hoping. I am hopeful. I believe that they're being straightforward with us on their promises. I'm hoping even that maybe they're under-promising and that they'll over-deliver, but I can't guarantee it. They did sort of backtrack a little bit by saying, I think maybe 3-4 weeks ago, they said for the next week or so you won't get an increase, but after that. And then this week they pushed it back 2 more weeks to the 29th. But I think it's simply a production. The factories are just, cranking these things out and filling the vials. And they're pretty certain. They didn't say we hope to. They said we will be the week of the 29th, which is pretty specific. We're going to get those doses. And the president went on national TV and said he wants to open the eligibility by May 1st. I want to make it clear he didn't say vaccinate everybody by then, because they won't have the vaccines. It's going to ramp up dramatically in April and then more in May. But May 1 is when you can start to get it going. But I have no control over it. I can only hope that what they're telling us is factual, and I guess maybe it's trust but verify. We're going to wait and see if they can deliver on the commitments.
Last question?
Yeah, go ahead.
You've been given lots of advice on individuals who very but here, I've heard just a few, not a lot, but there have been a few who have wanted to just take one particular type of vaccine. What do you have advice for folks who are adamant, they're not taking it, that's it, I don't want to do it. What do you have?
Well, you know, that's an issue that we're having across the country, and that's why we have a $2 million public information campaign with print ads and television ads and every medium we can reach to try to convince people with, you know, I think 20 different people doing commercials talking about the safety of the vaccine. The White House informed us this week that I think the president is going to commit $1.1 billion to that kind of a campaign to increase vaccine confidence and to overcome reluctance. So we're going to continue to keep messaging that because, I mean, we can't force people to get a vaccine, and we understand that there's some concern among certain people, but we're going to keep trying to convince them because the only way we really get it under control is to reach some type of herd immunity. We don't have an exact number. Different doctors and epidemiologists and public health folks have different levels of what percentage they think has to get vaccinated before we can stop this thing. But we all know that we have to get as many people vaccinated as possible. That's how we can all get back to, hopefully getting us back to the point where we don't have any kind of limitations and we don't have to wear masks forever and we don't have to worry about our hospitals overflowing and people dying anymore. I mean, that's the goal. And so we're going to just, at every level, I think we're going to continue to try to convince people that this is the right thing to do for them and their families and their neighbors. And if they want to get, back to the way life used to be a year ago, they're going to have to get the vaccine. All right? Thank you.